Today, we're talking about myelodysplastic syndrome. Since this is just a quick overview, I'll keep the explanation short and simple. Myelodysplastic syndrome is often shortened to MDS by using the first letters of each word. Alright, let's check out how often MDS happens. There are about 4.2 new cases per 100,000 people each year, and starting around age 60, the chances of getting MDS go up the older you get. MDS. So basically, with MDS, your bone marrow, the stuff that makes blood, is working overtime, but it's not doing a great job. Instead of making healthy blood cells, it's pumping out a bunch of wonky ones because of this clonal copy-paste style growth of messed up stem cells. That means people end up with low blood counts, aka cytopenia, even though the marrow is super active. One of the big worries. MDS can turn into acute myeloid leukemia, which is way more aggressive. In MDS, the number of abnormal cell clones goes up, which pushes out the normal blood-making process. Along with that, the body's blood cell production doesn't work right. That's what leads to cytopenia. In the early stages of MDS, those abnormal clones start growing, but your body's still making normal blood cells too. As the disease gets worse, more and more abnormal cells start to build up because they keep making copies of themselves. In MDS, hematopoiesis, aka the process of making blood cells, goes kind of haywire. The bone marrow wants to make healthy red cells, white cells, and platelets, but the developing cells are messed up in how they form. That's the dysmorphogenesis part. So even though the marrow is working hard, it's mostly producing cells that don't grow up right. Because of that, the body steps in and says, nope, not good enough, and clears them out through apoptosis, which is like a built-in self-destruct button for cells. So instead of those cells making it to the bloodstream, they're basically scrapped, leading to low blood counts. So, in short, the bone marrow is busy, but not productive, because it's making broken cells that get tossed before they can do any good. So imagine you've got a factory that makes cars, that if the factory's not doing so great, it's kinda sick, then the cars it makes are gonna have more issues, and if that happens, you're gonna end up with fewer normal, properly working cars coming out. And busted cars. Yeah, they're getting crushed. If you think about it in terms of how blood cells are made, the bone marrow's like the factory that produces them. But if something goes wrong with that factory, if it gets sick or damaged, it starts pumping out faulty blood cells. Basically, the cells come out all weird and misshapen. Bad blood cells basically break down. To see how blood cells change shape, you'll need a microscope. When you look at a blood smear under the microscope, any weird shapes or abnormalities in the blood cells are what we call morphological dysplasia of blood cells. A blood smear is when a tiny drop of blood is spread out thinly on a glass slide, then stained with special dyes so it's easier to see under a microscope. It helps to check out the number, shape, size, and overall look of your blood cells. A peripheral blood smear is a smear of the blood obtained in a normal blood sampling. A smear of bone marrow liquid obtained in a bone marrow test is called a bone marrow smear. Let's take a look at the microscopic image that actually appears in a blood smear. The following image shows a smear of bone marrow under a microscope. Typical microscopic features of MDS include several characteristic abnormalities. Neutrophils often show pelger-hued abnormality. Ringed sideroblasts can be seen in erythroblasts. Micromegakaryocytes are commonly found among megakaryocytes. Blasts may also be present. These findings can support a diagnosis of MDS, but it's important to note that they're not always seen in every case. So basically, what happens is that MDS starts to develop. At first, you see abnormal-looking cells in one type of blood cell. Then, those weird changes show up in other blood cell types too. After that, the number of blast cells, those immature ones, starts to go up. And once those blasts make up more than 20% of the cells, that's when it turns into acute myeloid leukemia. This part just goes over the typical lab results you see with MDS. In MDS, it's pretty common to find chromosomal abnormalities. Spotting those changes is actually one of the key things doctors look at when figuring out if someone has MDS. What's really important to keep in mind is that the type and number of these abnormalities can affect how quickly the disease might turn into leukemia, and how long someone might live with it. To figure out if someone has MDS, doctors look for two main things happening at the same time. Firstly, low blood counts. This means their body isn't making enough healthy blood cells. So they might have fewer white blood cells, fewer red blood cells, or fewer platelets. Secondly, specific signs that point to MDS. These could be odd-looking blood cells when checked under a microscope, like the cells just don't look normal, or certain genetic mutations that are known to be linked with MDS. So, if both low counts and those MDS-specific changes show up, that's how they confirm the diagnosis. What are the symptoms of MDS? Patients might have fewer white blood cells, and they might not work properly, so patients could get infections more easily, especially from bacteria and fungi. Low red blood cells can cause anemia, which makes patients feel super tired, short of breath, and like their heart's racing. If the platelet count drops, patients might notice tiny red spots called petechiae or bleeding gums. Some patients also get fevers that aren't from an infection. These are called tumor fevers. So, when it comes to treating MDS, there are three main types of treatments. The big one is a stem cell transplant. That's the only option that can actually cure MDS, but it's pretty intense and usually for younger or healthier folks. Then there's medication, like azacitidine or decitabine. These don't cure the disease, but they can help slow down its progress to leukemia and make blood counts better. And finally, if someone's dealing with low blood counts like anemia, they might get regular blood transfusions to help with that. So, with MDS, doctors usually try to figure out how things might go using this thing called the IPSSR. It stands for Revised International Prognostic Scoring System, but yeah, kinda a mouthful. Basically, it's a score based on 5 things: neutrophil count, those are a kind of white blood cell, hemoglobin levels, platelet count, how many blast cells are in the bone marrow, and whether there are any chromosome changes going on. All that info helps them get a sense of how serious things are and what the best next steps might be. The IPSSR looks at 5 things and sorts you into one of 5 risk levels: very low, low, intermediate, high, and very high. The median survival really varies a lot depending on the IPSSR group. It's about 0.8 years for very high, 1.6 years for high, 3 years for intermediate, 5.3 years for low, and 8.8 years for very low. How fast it progresses to leukemia really depends on the group, based on the IPSS-R classifications. For the very high group, it takes about 0.7 years, for high it's around 1.4 years, intermediate is roughly 3.2 years, and for the low group, it's much slower, about 10 years. Today's recap. MDS leads to cytopenia. Progresses over time. Often progresses to acute myeloid leukemia.